New patient coming up, 38 years old, thinks he needs an all-on. That's kind of young for me to want to do an all-on. I don't know what I'll say. I know that it'll be dictated by truth. Dr. S, how you doing?
I'm doing pretty good.
Good. Where are you from?
I'm from Sicklerville. I'm living in Sicklerville right now.
And how did you find me?
My dad heard an ad on the radio playing.
I love that radio.
Yeah, and my dad did too. Apparently, he's. I had just gotten over an abscess under. You'll know the tooth when you see it. It's this one. And once I was on that run, when I was on that run of antibiotics, as like I was, in pain there, I was like, I gotta get these teeth fixed. And my dad was like, oh, go to Dr. Rasner. He's got.
And he hasn't been to me?
No, he hasn't been to you. But he hears your ads on the radio because he listens to the radio. He works at a gas station, so he's listening to the radio all day.
Okay, cool.
So
nice.
Yeah.
So let me just tell you one thing real quick. I am on. You'll find all this out about me in a few minutes. But I'm on social media a lot with other dentists, because as you're going to find out in a few minutes, dentistry's been my whole life. It's 100% of my life.
That's awesome.
And like I've never golfed. I don't think it's a good thing. It's just true. You can't do everything in 24 hours.
Right.
I chose to do much of what I do, even when I'm not here, to be involved in dentistry, whether it's teaching, whether it's training somewhere, whatever it is. So he can't see you right now, but there's a guy videoing me because it helps other dentists. A lot of dentists don't understand how to meet somebody, believe it or not, like what we're doing.
Right.
Now, if that makes you uncomfortable, he'll cut it. It doesn't matter.
No, that's fine.
You cool?
Yeah.
He's back there. You don't have to do anything but talk to me, okay? Can't see you.
Yep.
Nor do they know who you are, obviously. So let me start with that. Look, I just started to tell you. I think it's important that you, when you sit in a dental chair, whether it's this one or one in Philadelphia, you don't know really the background of the guy that's talking to you. You don't know how into what he does. In fact, whether you're you're in bakery, right?
Yeah.
Baking. Do you have your own bakery?
No, I work at a different, somebody else's bakery, grocery store.
Yeah. So whether you're in that profession, whether you're a teacher, a lawyer, a cop, you don't have to be 100% into what you do to do that.
Mm-hmm.
You could be 50% in. And you could love other things. You could love pickleball.
Right.
You could love the arts, boating, whatever it is. For whatever reason, and in dentistry that is extremely common. A dentist, often in my opinion, from being in this for 4 decades, is into dentistry and he's also into 17 other things, often more than he is dentistry.
Right.
Okay? Because it's a hard profession.
I can imagine.
And it's easy to get burned out. It is. And so, for whatever reasons, intervention by God, I don't know. I'm lucky. Because I'm one of those guys, they say, if you love your work, you never work a day in your life.
Right.
I don't know if that's true, by the way. I love my work. I feel like I work a lot of days of my life. That said, I've always loved what I did. From the beginning, like when I was younger than you, in my 20s. So from the beginning, I started training everywhere in my career. Anybody that did something that I was interested in, I'm telling you, I signed up and I took their courses. Over and I went in my 20s. And it happened in my 30s, 40s, 50s, 60s too. I still train. And when I did that for a very long time, something cool happened. Dentists wanted me to start training them, which I never even thought about, right?
Yeah, at a certain point you stop being the student and start being the teacher,
get it.
right?
Yeah, right. And so, I remember it happening, like some state's organization like Alabama called me up and said, and I remember like hanging up the phone, shaking from happiness. I was so excited that someone valued my opinion on something and wanted to not only me to share it, they were going to pay me for it and fly me down there and put me up in a hotel. I remember it all. And that made me absolutely to the next level of berserkness in my commitment to dentistry. It's true. Like if somebody wanted me to teach them, I better know what I'm talking about and give them a safe protocol. It's true. And that's how that happened. So I've been doing that for 25 or 6 years. In fact, 2 weeks ago, this office, which it does 5 times a year, serves as a institute where guys come in and I train them in surgery things, surgical extractions, something called grafting, implants and stuff like that. Okay? So the bottom line is I love what I do. And the other side of that you need to know is that, obviously you can look at me, you can tell I'm not 40. You have to laugh at that. You know, but I could be doing the grandfather thing. I don't have to be a dentist if I don't want to be a dentist due to income things. But you know what? When you do your whole life and that's what you do, it's hard to give it up, right?
I can only imagine.
You know, my skill set is as good as it's ever been, so, you know, unless that changes, I'm in. So that's who I am. So, enough about me. I know a little bit about you because I make it my point to know about. Can you make these bigger or not?
Of course.
I make it my point to know a lot about patients, okay? Before you get my chair. And I know, correct me if I'm wrong, that you, when I look at you, obviously you have aesthetic issues, you have multiple broken teeth, decayed teeth, blah, blah, blah. And you were interested because you made it a point to tell Michelle with the concept of all-ons, you know, of teeth that are, take your teeth out, have implants, and put teeth on those.
Yeah.
Okay. So I'm going to tell you something interesting about that. I do them, okay? And I'm pretty selective how I do them for it. I'm going to tell you what I used to do, and I used to be against all-ons, but I'm going to tell you why I'm not now, okay?
All right.
So I started training in implant dentistry 30 years ago. 30. You were 7 or whatever,
Yeah.
okay?
Okay.
And when I trained, a lot of the concepts of implant dentistry that we use for all-ons weren't taught. For example, when you do an all-on, I don't know how much you know about it, you look like a guy that would Google all this stuff.
Yeah, I got a vague.
So there's a lot of
Awareness of what it is.
protocols and different ways to do it. Here's what I do. I take all this data that I can get from what you have right now. Part of it we just did, the x-ray.
Right.
I take a lot of photographs that are important. I take models and scans of your teeth. So I know everything, the lab has everything about you that I have right now. From that, I'm able to design a smile for you and a new set of teeth. Not everybody does it this way. And mine's called Chrome Guided Smile. And there's a million of them. And what that means is your teeth are set, ready to go the day I do your surgery.
Awesome.
Right? And this is very in contrast to what I used to do, which I'm going to tell you about in a minute. And I have a reason for telling you that. So you would come in and you would be sedated, not with my pills, I mean sedated, say IV sedated.
Right.
So I have somebody that does that. And you need to know this practice became very popular and very busy for the last 30 years because I orally sedate, that's not IV, a lot of people. And I tried to do that with all-ons and it doesn't work. It's too much. You're doing too much stuff.
Right.
You got to be out, right? And some doctors do both and are comfortable doing both. Like they knock you out and they're looking and they do their thing they do to knock you out and then they're doing their dentistry. Are you kidding me? I would never do that. I mean, I am focused exactly on your mouth and nothing else. I don't even want to be thinking about anything else except that.
That's probably the best way to do it.
I would think so. So I bring somebody in to do that. This third person of the team, besides me and the anesthesiologist, is the lab guy that I just talked about. So he's designed your teeth, right? So picture this. I've already planned out before that day, with the x-ray she just took and everything else I have of you, exactly in your mouth where your implants are going to go. I planned them so exact, I can't even be off a little bit because I have teeth that are fitting where those implants are going to go.
Right.
When I even say that to you, it's kind of bizarre to me that I can do that. But I've been doing it for a while and it absolutely works. Okay?
Yeah.
So
Cool.
you walk out that day, you kind of like stumble out, I should say.
I was gonna say, is this one of those anesthetics where like you see people on the internet and they're all saying weird stuff?
Yes. No, you're out more than that, to be honest with you. You're not saying anything.
Right. Good.
Okay. So you're home, and when you come to and all that, and you wake up, there's teeth in your mouth, a new smile, and you're wearing that for 5 months, and that is made of a different material. And the reason we have you, that's how I do it. And you wear it for 5 months because you're going to shrink underneath of it. You can imagine that, right?
Right. It's like your inflammation goes down from after having the teeth.
because I took
pulled
your
out,
teeth
right?
out, I
Yeah.
grafted you, and that's all maturing and becoming fully developed. And then if there's a visit where you come in, there's no anesthetic for this. You don't need it. We take off your teeth. We take an impression underneath of it, right? where you've shrunk. And I send that out to a lab, and I have a backup set of teeth you go home with. Same teeth you've been wearing, actually. Same exact look. And then I make a different material, because the material you're wearing for 5 months is a resin. A resin means like a hardened plastic. It's very strong. It's very aesthetic. It looks beautiful. It's just not your final product. And that's how an all-on's done.
I like it.
Yeah.
It's
What's
cool.
different about that from what I used to do, I wouldn't even dream of doing it. In fact, because of what I do and my visibility in my profession, I've written 40 to 50 articles in magazines that have been published. You know, I've lectured a million times all over the country. I said, you shouldn't be doing these. and the reason I said it was because I didn't think patients could maintain them. But, you know, because you can't get under there, so you have to learn tricks with water picks and other things we give you to clean them.
Right.
And I thought they would all fail because of that. So when I once wrote an article against all-ons, that was published. I didn't really was against them. I said an alternative to all-ons, because I used to make things that you could snap on and snap off. Okay?
Right.
So the main difference between what I had and what you're getting would be that mine you could pop off and clean underneath. The problem with that, well, first of all, I was wrong. People can maintain them, and they look great. I don't get it, but it's true. I've done enough of them to know that now, okay? The other thing is, I didn't know you could load them immediately. Load them means put your implants in and put teeth on them right away like I'm going to do you. Because that wasn't taught to us, right? If you came in here for a single tooth, a molar back here, I would take your tooth out, put the implant in, and I would wait 3 to 4 months to put the tooth on it, okay?
Right.
Sometimes you can put a tooth in the front because the pressure and the mold is not so hard in the front. It gets greater as you go back.
That
Get
makes
it?
sense.
Right?
The way teeth work.
It is, that's the way, because your teeth set up like a lever like this, like a nutcracker, right? So when you crack a nut, you don't ever put the nut in the front of it, you put it where the power is back here.
Right.
It's the same physics as your jaw. Same thing. So you're right, so I never load that, but when if you put 6 implants in and you can get the right torque, which I know I can, you can load it, and I've done it a million times. So I was wrong about that too. Okay. So I'm the kind of mind that, you know, if I'm wrong, fine. Let me grow and do it better.
Right. That's the only way you can learn is to be wrong and then figure out why.
But what I used to
Makes
do with a guy like you is if you kept these teeth, and I'm not telling you that's not a possibility, I'm just saying you'd have to crown. First of all, there's some teeth here that are gone and done. You couldn't do that. There's other teeth on you that could be saved. It's true. But let me see something on it. I didn't ask this. Let me see your bite. Way down. Ah, great. Oh, yes. Yeah, you're a good case for that. So the problem is you're 30-some years old, right?
Mm.
And it would be enormously costly, as costly as the all-on, okay?
I figured that would be the case. That's why I was going to go for that anyway.
Yeah.
It was like, if I really got it fixed, is it even going to be cheaper? Like, you might as well just get a more permanent solution.
And
in the first place.
if you know, and I can't say to you because you're fairly, I mean, young in this procedure. We've done others like you. I've got one right now that's 10 years younger than you, and you know, well, I don't know what 30 years from now is going to be, you know, but that's not a bad lifespan either, you know.
Mm-hmm.
So the reason you are like the poster child for when I recommend them, because it would be just as much or more for me to not do that and keep your teeth. And there's no way I'm going to look you in the eye and say that you're going to keep the teeth I make you if they're crowns and stuff for the next, I mean, if they lasted 15 years, I'd be thrilled. 10 years, I wouldn't be mad. Sometimes they last forever. That when I talk about a crown, it's different. It depends, as you can imagine. You seem like a bright guy to me. On your bite structure, what you eat, your hygiene, everything. Okay, so that's the deal. So your upper's pretty easy to talk about. Let me look at your lower, which I haven't focused on too much. Let me see it.
Just open them out there.
Now I'm going to see your x-rays first.
Oh, that's right.
All right, so you're going to lose a wisdom tooth, that's for sure. You're going to lose, this is your left side I'm starting with here?
Yes.
So who cares? You're losing your back wisdom for sure.
Yeah.
You're losing these 2 guys in the middle. you're losing your eye tooth, I mean a premolar. So you're literally losing all but, and this one has an infection into your root canal tooth. Damn it. So I got one over here.
Still?
So,
Is that? I
yeah,
guess
so
it came back after the.
yeah, so watch, look. Do you see this area outside of your root right
Yeah.
there? See that?
Yeah.
That means there is some infection present still.
Jeez.
Now, it's not the end of the. There's still a way if we that's what we decided, and let's hold for a minute on that. I don't know how I feel about it right now. That's the truth. Okay, your back molar. So I know this molar's gone. I know the two teeth in front of this, which are right here, they're gone. Your eye tooth, is that his eye tooth? His
Yes.
cusp? That's gone. Let me see your lower fronts. They're not horrible. Keep going. They got cavities and stuff.
Right. So, but is that like an active thing that I should be worried
Yeah.
about right now? Because I don't feel any pain there.
No, it's so infections can be acute or chronic. It's chronic. It's been there for a while, and infections in dentistry don't always hurt people. There's people that have a lesion like that for 20 years and they don't even know about it.
Crazy.
It is crazy. It'd be much easier for me if I was a dermatologist, right? Think about what they have to do. Do I have to convince you there's a giant rash on your face? You see it, or your skin, or your body, or any part of your body. In dentistry, it's really hard for people to understand. Well, how could that not hurt me? And I've been doing this for 4 decades, and I can't explain why it doesn't. And it may never hurt you. It's just not good for you. If you came in here today and say, "I'm getting a fake knee," which people do all the time, I need clearance for it. I couldn't give you clearance for it because I know what I'd see here. Now, I have to say this to you. You see where your root canal ends right there?
Mm-hmm.
Your root ends down here. See how this one goes down further?
Mm-hmm.
So I know why that's failed. And it doesn't mean, and it's important to talk about this with you and your lower, it doesn't mean that you had to get that tooth out. If that was your only tooth problem, I would say get a root canal retreated and let somebody do it right. They wouldn't give me 100% success on that, but it's pretty high. It's pretty high because I see what's wrong here. The root canal belongs down there, not up here.
Right.
What that means is bacteria was left down there. He didn't do it on purpose. I'm sure when I used to do root canals, which I don't do anymore because I'm not fast enough, these guys are ridiculous. You know, within an hour they're done.
Yeah, that's how it was with mine when I
Right?
got it done, 5 years ago or whatever, 6 years ago, how long ago
Yeah,
it was.
well,
Obviously, it was in and out like.
I don't know if that was this one. This is your lower, right? So
I think
let's dial back to what are we doing, or what are your possibilities for your lower? Okay, because there's lots of ways people do this. Some patients come in here and they treatment plan their upper and their lower. I got a guy here in a minute. It's 70 years old. It just did this at 70. Okay, he had an upper and a lower. His is done already, and he's here now for what's called the post-op, meaning we see you for the next 3 weeks to make sure everything's good. Okay?
Right.
Some people just have the upper done and they wait on the lower. Now you do have some things you should do on your lower if that's the direction you take. A lot of it comes down to, cost and what fits in your world and all that kind of stuff, to be honest.
Right.
So, but I'll say it again, if you're going to be under, like IV and I'm doing your top, if we choose not to do your bottom, you definitely want me to do some things at your bottom, like get rid of these hopeless teeth down here. These are on your lower left.
Mm-hmm.
Got me? So part of that's you. Like, you got to tell me where your head's at. Like, what do you want to do? Because even if we did your upper and your lower, with the man I just told about, I did him the same day. You got a lot of teeth to take out. I would probably distance yours 4 to 5 weeks apart. So, if you did your upper and lower.
From each other, like do the upper on and then.
Yeah, then
do
wait
the lower.
5 weeks to do your lower. It's a lot on you to do both the same day. There's a lot of guys that do these that wouldn't think the way I'm telling you.
Well, I'm going with your gut. You're
Yeah.
the professional,
I mean, I tend to be conservative in everything I do, medically. So let's first back up and say, what are you thinking when you think of what you want? I know what you want on your upper. The lower, how do you feel on the lower?
My hope was to get a full arch on both
On
upper
both,
and
okay,
lower.
right.
but it's like, I mean, they told me that the cost is high, and I mean, I don't know if my credit's good enough to
Okay.
front that. I'm comfortable getting the whole thing
Yeah.
out and.
It's
all
not a
charges.
terrible idea. Listen, if you don't know me yet today, you'll get to know who I am. I mean, I never come in here with a business point of view in my head. I don't, you or anybody else, it doesn't matter to me, whether they do anything with me or not. What matters to me is I give you the right guidance. You.
Right.
Even if you didn't come to me, like you left this office with a good feeling about me, and trust me, and were confident in me, because that's the most important thing to me. Okay. So what I'd want you to do is, she can quote you for an upper and a lower. Michelle's going to do that.
Right.
If it, for whatever reason, if the credit doesn't cover that, or whatever, I get that, it's a big investment. Then we'll have a plan B on your lower, and your plan B would be this, okay? It would be take out hopeless teeth. Now, if we do that on you, you might have some gap. Well, you know, you're walking around like this right now,
Right.
so I don't think gaps are going to freak you out.
No.
But think about it. If you're out and under, why wouldn't I take out the hopeless teeth that could... I wouldn't even include the one I was talking about over here, by the way. Right? I'm talking about teeth that are worse than that on you.
Right.
So I want to look at those teeth right now. As I'm doing this, let me ask you a couple medical questions. You have diabetes?
No.
You smoke?
No.
Yes. That's a good answer. Anything medically going on?
When I went to the urgent care to get the antibiotics when I had this
Yes.
abscess last time, they said my blood pressure was high.
Okay.
So I haven't been diagnosed with any high blood pressure, anything, but just so that, you know, look
Yeah.
out for it.
You should, I mean, that's not going to stop me from doing this, but just for you, you should check that out.
Yeah.
I've been on high blood pressure medicine for 20 years, to be honest with you. So what I'm doing right now is I'm kind of looking everything over, particularly your lower, okay? Because I kind of know where your upper is. Yep. Okay, so 17's out of there.
Mm-hmm.
Yeah, Rachel, you can have a seat in the big chair.
20 is out of there. 21 is out of there, and 22
Mm-hmm. Yeah, 22 you'd already.
we talked about. Okay. Let's see the other side.
Mm-hmm.
I feel like he's got to do 31. I'll explain this to you in a minute.
Full coverage?
No, like 31. Let me just look at it again. I mean, a cavity looks like it's in, is what I'm saying, you know.
So 31 RCT core frame?
Yeah. No. Like,
RCT core.
I was leaning on the lines of removal, is what I'm saying.
Oh, I gotcha.
And put a question mark by that. He's got decay everywhere.
Mm-hmm.
I'm just having second thoughts. Here's what we're going to do with you. When I look at you close, sometimes when you look at a patient like I just did you, they look better than they did on the x-ray. You don't. I'm just being honest.
No, I get it.
So I don't feel that a lower all-on, I think is indicated too. If you can't do that, for whatever reason, maybe you wait 6 months or a year. I'm trying to figure, do you have any lower pain at any point? When you went for the urgent care,
That was on the lower side, yeah.
which side, do you remember what side?
It was
There.
this hollowed out one back here. I
Okay,
think
okay.
was
So
the
those
culprit
teeth
there.
should come out,
Mm-hmm.
his left side. I don't think I need to do the right side.
Okay.
Okay?
Mm-hmm.
And then what I would say, let's cross that bridge if I'm there in 20 minutes and say what else I would do.
Okay.
You know, I don't want to like waste your time talking about something that may not happen. Maybe it works for you the way they're, you know, your credit and all that stuff.
Right.
Okay. Okay, so what's going to happen now? You're going to sit here, and Michelle's going to come in quickly and go over these things, that the procedures I told you, the cost involved in the procedures, okay, and the cost for the anesthesiologist, and all that stuff. Okay.
Okay.
And then let's just say I'm not a pressure guy. I'm not that guy. A lot of these places bring in a ex-car salesman at this point. Would never dream of that. It's not what I do.
It's good.
You know, I already said what I wanted, and I stand by that. And the only thing I got to figure out with you is if the lower doesn't work out, what's responsible that we should do to keep you. You know, you don't want me to finish your upper, and then 6 weeks after I do it, you start popping abscesses
Right.
on your lower on things I can see. Okay.
Right, that makes sense.
All right, my man. You want to drink water or something?
Sure.
Yeah.
That's
Somebody's
where
working
I got
too.
one.
Yep.
Am I following you or am I staying here?
You're staying there.
Okay.
Hey, Ashley. Can you get me a bottle of water out of the fridge for room 7? Somebody's got it. Never mind. Room 7 and room. So, tell me what. So what do I have here? Well, believe it or not, it doesn't, I know you believe me, it doesn't make me happy to see a mouth like that. It doesn't even align for me with that particular patient's personality. Like, he seems accountable to me. He seems like a quality guy. Not that everybody who loses their teeth aren't quality, but a lot of people don't own that. He seems to own where he's at with his mouth. And looking at him, he's got so much pathology from perio disease, multiple non-restorable teeth, multiple periapical abscesses. This is the case for me of a patient that would not be making a mistake with going into the restorative space of all-on X dentistry. I feel confident that is where he should go. What I have to do is that if the cost is formidable for the upper and lower, and that's going to be up to him, I had to come up with a responsible plan to hold him over without diving in big financially on his lower, because he's going to end up with a lower all-on too.